everyone, and welcome to the Perimenopause and Beyond Masterclass series, where we're bringing together experts from female physiology, training, nutrition, recovery, and just from a huge assortment, and coming together and really focusing on how do we be our best in sport and in life. And today we have Dr. Juliet McGrattan. So welcome. I'm so happy you're here with us.
Thank you very much for inviting me. I'm really pleased to be here.
Yeah, so let me just tell you, everybody a little bit more about you. You have really come into focus with running and health. So you have been a general practitioner, like a doctor in the national health system in Britain for 16 years. And then do you still practice at all as a GP?
No, I gave up my clinical practice a couple of years ago now to focus on everything else.
And that was because, I'm assuming, because you have really dove in deep into health writing, translating science for us is really what you're doing. Becoming an international speaker, blogger, podcaster, women's health lead, and master coach for the 261 Fearless Global Running Network. And so thank you for taking those 16 years of your life and then bringing it into something that we can really, bite our teeth into for, those that are runners. And if you're not a runner, keep listening, because there's so much that we can learn just generally in this interview and what we're going to get into. So I'm just going to say two more things here before we launch into it. So Dr. Juliet's first book was called Sorted, The Active Woman's Guide to Health. And she was awarded a first place in popular medicine at the British Medical Association Book Awards. So that was just her beginning of her writing career. And I was very lucky to receive her second book, Run Well, Essential Health Questions and Answers for Runners. And we're going to have to get into it because this is a phenomenal book that I can't wait to share with you a little bit more. So welcome. Is there anything else that I should be, saying and telling the world about who you are and why I'm so happy to have you here?
No, as you say, I just realized that there was so much health benefit and wonderful things that you could get from being active, and I just wanted to share that not just with my patients but just with the wider world and women sort of in particular. And that's where kind of life has led me. It's a funny old world.
It is, isn't it funny how it just kind of comes together? And obviously you're a runner yourself and passionate about it, but what I want to go into with you is I want to talk about strength training. And
yep.
Because I know for a lot of women, it's a challenge, and how to do it, because especially for those that love to run, we have been always thinking, yeah, but running alone is good for our health. Like, there's pounding on the pavement. Why else? What else do I need to do? And can you just get into it really, like just dive right in really quickly of why do we need to do the strength training, particularly in perimenopause, and then for the beyond part as well?
Yeah, I love this topic. And I think part of the reason I love it is because I've found it very difficult to do strength training, and I'll maybe share some of that with you in a minute. But for me, it was actually understanding why I needed to do it that's made the difference. Why, I'm not bothered necessarily about looking really toned and having a six pack and all the rest of it. But I've begun to understand really how important muscles are. So rather than thinking about strength training to actually kind of get muscle tone, I'm actually thinking about it because I want the muscles. And why do I want muscles? And one of the reasons is because we're now really starting to understand how important muscles are in the body for actually keeping us healthy. Because all those kind of major diseases like heart disease, diabetes, cancer, depression even, we now understand that part of the reason those happen in the body is because of inflammation. There's like a low grade inflammation that goes on in the body and increases our risk of all those diseases.
Mm-hmm.
So anything that we can do, which is anti-inflammatory, will help reduce our risk of getting those diseases. And muscles have a role in this, because when you use a muscle, it releases something called myokines. And myokines, they have an anti-inflammatory action. So you go for your cycle, you do your climb, you bike ride, whatever, and the muscles release these myokines and they zoom around in your circulation. If you've been doing vigorous exercise for a while, they might be there for a few hours afterwards, and they have a kind of an anti-inflammatory effect in the body. Now, as we age, we naturally lose muscle. And around the time of the menopause, that loss speeds up for a few years quite dramatically. Then it drops down again but still being a reduction, but a slower reduction in later years. So around the time of the menopause, we really do start to lose. We're quite used to talking about losing bone, and we think about osteoporosis and things, but we're less used to talking about muscle and the condition called sarcopenia, where you lose muscle mass. Now, anything that we can do then to actually increase our muscle mass so that it doesn't reduce, or at least maintains where it is, or it even gets higher, will mean that we have more muscles, that we have more myokines, we have more anti-inflammatory action, and then we have less risk of disease. So for me, one of the main reasons why I really wanted to get some muscles was because I know they're going to keep me healthy in a way that I maybe hadn't thought of before. So that's one of my kind of top things about muscles.
Yeah. Can I just ask a little bit more about this, like inflammation in the myokines, because that is really interesting. So help me understand. So when we train, when we stress our body, part of it is that we are actually creating a bit of inflammation. Is it not, when we're tearing our muscles a little, like not too much, but tearing our muscles? The idea is that we're putting strain on them, more blood is rushing, inflammation occurs. But is it that the myokines are bringing down inflammation later, or like, help me understand that?
Yeah, sure. So, I mean, I think you're right. When you exercise and you stress the muscle, you do cause a little bit of muscle damage. They're called micro tears, they're called, in the muscles, that when they repair, they then over repair, if you like, and make it a little bit stronger. So the next time you use it, you've got. So this is a different type of inflammation in the body. This is a more sort of general, what's called sort of systemic inflammation in the body, rather than something specifically in the muscle itself. So it releases lots of good chemicals as well. And one of those is the myokines, which go round into the general sort of circulation to reduce inflammation.
I've never understood that. I've never had that specificity. I think that's really interesting. So there's inflammation specificity to the muscle, which is good. We want to strain because that's how we get stronger. And then there's also the general system of reducing inflammation specifically through gaining strength. And I'm hearing you right. I'm repeating it, so I just make sure I'm understanding.
Yeah, and interestingly, one of the other things in the body that causes a lot of inflammation is visceral fat. Now, you might have heard of that. That's our internal fat that sits around our internal organs, like our heart and our liver. And when you exercise, you could reduce your levels of visceral fat. So then again, because the visceral fat is pro-inflammatory and it causes inflammation, the less visceral fat you have, the more you'll reduce inflammation. So when you're exercising, whatever type of exercise it is, you're actually, it's very responsive to exercise, visceral fat, and it does really reduce it quite significantly. So actually you're going to kind of getting a double thing there. You're getting the myokines to reduce inflammation, and you're getting a reduction in your visceral fat, which reduces this general body inflammation even more.
Oh, I love it. And that is you touched on it. So the difference between visceral fat and subcutaneous fat. And I don't know if you want to go there, but the subcutaneous fat, a lot of women in perimenopause all of a sudden say, oh, I've gained some weight. Is there, would you venture into that? Isn't that helpful?
Yeah,
is that helpful, that subcutaneous fat, because we're lowering our estrogen, and is that a helpful thing to actually have a little bit more? Or, how do we think about that?
Yeah, so that's one of the other reasons that I wanted some muscle, actually, is because I'm just, what am I now? 48. And I just started to notice that I was getting thicker around my middle. I hadn't changed what I was eating or the way that I was training, and I was like, what on earth is going on with my body?
Yeah,
You know, I kind of get flab hanging over the top of my jeans, and I was thinking, this is something's not right here. And actually that dawned on me that this was probably the start of the perimenopause. And we know that around the perimenopause, women's bodies do change in the way that their metabolism changes. The way your body uses energy changes, and women do tend to store more fat. Their basal metabolic rate reduces. Right. So that your basal metabolic rate, you're probably aware, is the amount of energy that you're burning off just by sitting there, just by living, by breathing, by digesting, all those normal bodily processes. And women around the menopause, their basal metabolic rate reduces, so they're using less energy just for being alive, and they tend to hold on to fat more easily. They can sometimes described as becoming a little bit more sensitive to carbohydrates, so that you do tend to retain fat. So, you know, one of the things that I thought was, okay, right, I don't really want this fat around my middle, because I know if there's more fat around my middle, there's most likely more fat gathering around my internal organs as well. Because that central kind of fat is a sign that the bigger your waist, the bigger the likelihood that you've got more visceral fat. So how can I change that? And if we can grow muscles, then we can really give our metabolism a right good shake up and a right good boost, because if we're increasing our muscle mass, we'll increase our basal metabolic rate, because muscles burn off more energy than fat does. So another reason for adding in strength and conditioning around the menopause is to actually have a really positive effect on your metabolism and help you control those naturally happening changes to your body, where you do start to become thicker around the middle.
And not that there's anything like wrong with having more thicker around the middle, but it's just another thing that we just want to be aware of in terms of overall health, or, you know, what.
Absolutely. I mean, you know, it's how you feel about yourself, isn't it? And if there's things that you think, oh, I don't like what's happening, or I don't like this change, then you may want to do something about it. But yes, oh, believe me, there's plenty of plenty of fat on my body.
So let's go into, I know one of the things that you speak to and have a lot of knowledge in is how do we make these changes? Because sometimes it's hard. Like I like just to be outside. Like I just want to go for my run, or, you know, and then, so I know you said, you know, you first started saying, well, why are we doing this? So can you talk a little bit more about taking that next step? So now I'm convinced I need muscles. Now what?
Yeah, and I think you're right. You know, changing your behavior is really hard. I mean, you know, New Year's resolutions, they don't last, do they? And for me, like you say, finding out the why is the game changer. What difference is it going to make to you? And I think actually really sitting and spending some time thinking about that. What will be better if I make this change? What will be worse if I don't make this change? How is it going to affect me in my life? How is it going to make me more able to do the things I want to do? And really bringing it back to finding your why. And once you've kind of got that purpose, then it is about sort of applying that and thinking, okay, how am I going to make that effective in my everyday life? Because if you set the bar too high, or you set yourself a ridiculous expectation that you can't meet, then you just very quickly fail, don't you? And then you just think, oh, blow it, and you kind of give up. So behavioral change for me, once you've found your why, it is then actually thinking about, what can I do what's the one very small thing that I can do that I know that I can achieve? And then when you've achieved that, you get a kind of a positive feedback. So rather than thinking, oh, blow it, you think, okay, I've done that and I've integrated that. Because to make something a habit, you have to keep doing it over and over and over again. It takes weeks, if not months, to actually get a new habit established in your life. So you've got to be really patient with yourself, but you've also got to break it down really small. So you just do one small thing, and then when that's a habit, you can add another small thing. And just knowing that all those small things add up can be really powerful in making a change. And I think, sorry, I'm just
keep going on. This is what it's about. Keep going.
I think two things really. I think you found that why, but it's still hard to stay motivated.
Mm-hmm.
So thinking about things that you can do that will constantly top up your motivation. So for me, I like to read a little bit of a book or something that I find inspiring every morning before I look at my phone. And then that carries me through that day sort of in a positive frame of mind, or listening to a podcast about something inspirational, or belonging to a community online where there's always inspirational things or something, so that you've just got something reminding you of your goal. You know, people stick pictures and things up on their fridge or whatever works for you, so you kind of got that topped up. And also realizing that failing is setbacks, should we call them, are normal. You can't succeed without having lots of failures. So when things don't go right and you do go off track, not just saying, oh, I'll blow it, thinking, okay, that's fine, that's normal. Why did that happen? Was it because I hadn't got enough motivation? Was it because I was too tired? Was it because what I was doing I was finding boring? And actually, what can you learn from it? Because if you can learn from that little setback, then next time when that thing happens, you're kind of prepared and you're pre-warned, thinking, oh, okay, I know this little red flag. This is some time I often go off track. This is where I failed last time. I'm not going to fail this time. And so kind of accepting setbacks as part of the journey, I think, is really, really important.
Yeah, and really holding on to them as to saying, okay, so how, I love it, like having that curiosity to really come into it and say, okay, so why? Like, why did I fall off? Was it my calendar? Did I like just jam pack it full? I mean, women, right?
Yeah.
We're kind of known for that. Like, especially the women that are listening to this, these, you know, the women that are listening to this are the type of people that are up to something and want to keep going and are thinking about their health and doing stuff. And so they might be doing that in the other aspects of their life, and it's okay. Yeah, I love that. So tell me, would you tell us a little bit more of your story?
Sure.
How you came to it?
So, I mean, I've run now for about 13 years. And I have to admit, for the bulk of that time, I've done little other than run for my exercise. And I became increasingly, thankfully I haven't been injured, but I've become increasingly aware that running wasn't enough. That yes, it was strengthening my bones because of the impact, and yes, I was getting some muscle strengthening from it, but that it wasn't enough, especially now I'd got to, menopause age. And so I really wanted to take some positive action. I thought, I've read so much about this, I've learned so much about this, I've spoken to so many women, seen so many patients, and I know there are so many positive things that I can do that will make me feel better now, but that will actually kind of future-proof my body for the future, so that I can stay independent and I can still be running marathons when I'm 80 or whatever. So at the time, it's hard to do those things because the future seems so far away. But I just thought, no, I've got to do something now to make those years better. And I knew that strength and conditioning was something that I was really weak at. So I was determined, and I've tried so many times to introduce it. I've tried lots of different things. I got a new notebook because I love a new notebook.
Right.
And I got some light hand weights, and I started doing things at home and writing them in and what I'd done and how many reps.
Yeah.
And after about a month, the weights were sitting in the corner of the bedroom, and I would just look at them or trip over them and feel guilty that I hadn't done it.
Yeah.
So that wasn't working. And then I thought, well, maybe I could go to a class. But I live very rurally, and to get to a class in an evening with the kids and this, that, and the other just wasn't going to happen.
Right.
So yeah, I kept trying, and nothing was really working. And actually, what changed for me particularly was during the first lockdown, because changing behavior is really hard, but it's often easier when you're at a sort of a transition point in your life. So a transition like the menopause, oh gosh, that's a big transition in itself. It's often called the change, isn't it? But also a change in our habits and behaviors because of being in forced lockdown and being stuck in the house. So this was about a year ago, almost exactly a year ago, actually. And I saw that as an opportunity, really, to try and get some new habits. Exercising in the house became so much more normal. It's maybe something I would have done and shut the bedroom door and not really wanted anyone to see, but there were 5 of us at home. My husband had his indoor bike on Zwift in the lounge. My daughter was doing her ballet class in the kitchen, and so it just became sort of normal for them to step over me while I was doing some online strength classes.
Right.
And I signed up for I signed up for a year actually, because I thought I'm going to invest in this because I'm going to make a commitment. And that for me has worked. Everybody's different. I needed something that was flexible, that I could do whenever, but that was guided, that had some motivation, that had some reminders, that had something to sort of drive me and keep me going, something that I found quite fun. And that's what I've done, and the way I've sort of incorporated it into my life. And a year later, I'm still doing it at least twice, sometimes 4 times a week, between 25 minutes and an hour of classes, 3 or sometimes 4 times a week. Yeah.
That's amazing. Yeah. Is there accountability in that? Like, or did you need accountability? So I know that for some people, so you mentioned connection, and being like, you're in a kind of a group, it's guided. Is there accountability, or that wasn't something that you needed particularly? Like,
it's something I've always got with my running, through running friends and running with other people. And I did mention, obviously I wasn't seeing many people. I was running when we were allowed to with one friend, and I told her what I was doing, and my kids knew what I was doing. And I had to, I got accountability on the screen to say, had I done the classes that were set for that program for the week. I guess I probably would have got extra accountability if I'd put it online, and I did actually think about sharing up Instagram stories and things, about what I was doing, and I do think that does make you step up, and that does make you do it. Although I have to put my hand on my heart and say, there have times when I've done that before, like when I decided that I was going to learn how to do the splits, and I was putting on my Instagram stories, every day. My daughter was coaching me, and how much we had a tape measure, and how close was I getting to the floor, and it just didn't last because it was so painful.
Well, your why may have not quite been there. Like,
I think there wasn't really a good why. Why do I want to be able to do this? Exactly. So I think accountability is very, very helpful, whoever you choose or however you choose to share it with somebody.
Yeah, interesting. I know that I have now my friend calling me each week and making sure that I'm being accountable to my strength program. Okay, we don't have too much time left, and I really did want to spend a little bit of time getting into your new book, because when I opened it up, I looked at it and I just started going through it. And what this book is it's questions and answers. Like, and it comes everything from motivation to dementia to heart rate, how to train with heart rate, blood pressure, you even put Raynaud's disease in there. Like, I have Raynaud's, and I'm like, oh my goodness, there it is. It was amazing. I was like, varicose veins. You talk about breathing through the nose, which is really exciting because I have an expert on breathing and talking about breathing through the nose, and there it is in your book. So breathing through the nose, we talk about windy while running, GI issues, pelvic floor health, hydration, female and male physiology. So if you have a friend or a partner, like you cover it all. Injuries, painkillers, how to use painkillers, which ones are best. 230 pages of questions and answers. How did you come? Like, I'm just like, I don't even, some of those things, like I just ask myself, but I'd have no idea. And some of the things I would never actually ask out loud. And there you've put it for us in this book. How did you come up with such breadth and really bringing it to all of us?
I'm glad you like it. Thank you. And hardly anyone's seen it because it's not quite out yet. So I think 2 things. First of all, it comes from being having been a GP for 16 years, where every 10 minutes you're asked a question about a different part of the body. So for me, it felt very natural to write sort of in that way. And secondly, because for the last 8 years, maybe, I've been doing health writing, and lots of the things that I do are people asking questions. So as I've gone along, I've kind of gathered all of the common things that are asked, either through the health writing or through the running clubs and the women that I've been helping with their running, and men as well, because this isn't, as you say, this is a book for men and women. So I've kind of, and the book goes through each body system. So dividing it up into the systems, and then thinking about that system and thinking, what are all the things that people have asked me over the years, or what are the things that I've learned? Because, when I started running 13 years ago, I didn't know many of the answers to these things, because being a doctor doesn't necessarily give you information about how to relate it for a runner. and what a runner really wants to know and what's useful to them. So personal experience as a doctor, and then experience of the amazing running community that I've written it for.
Well, it is. It really is truly something, and you can tell that you're bringing in that expertise when you go through it. And just so people know, do you know when is the launch date?
It's on the 18th of March. So,
yeah. So by the time that everybody is listening,
of course, yes.
And I will just say now, what the gift that we have by listening to this series is that you'll get 25% off the book by going to the link that we have provided. So get your copy, because it's really bringing this science. So, in the introduction to who Dr. Juliet is, it is really translating a lot of science into something that is really tangible and easy for us. It's not just for runners, although, it is definitely for runners, if it makes any sense, because these are things that we all encounter in our sports and how we live actively and move. So I would encourage you to consider it, even if you're not a quote unquote runner. Okay, so we don't have much time, so I'm going to go into the rapid fire questions. Are you ready?
I'm terrible at these.
I know. And I'm asking everybody because it's so perfect. It's just like everybody gets the same thing. And all right, give us one moment of courage.
I've had a few in my life. I'm going to go for finally stepping away from a career in general practice and losing that financial stability of being a doctor.
That would have taken and following a passion.
Yeah.
And what you're also extremely good at. Well, I'm glad that you did. I'm glad for all of us that you did. So congratulations. Tell us one thing that you're really grateful for right now.
Right now, I'm definitely going to go with, I'm sure, what a lot of people might choose, and that's good health. The last year has shown me how important it is to be healthy, and I've been so fortunate and kept well through all of this so far, and feel prepared if I do get infected before I get my vaccine, that my body is strong, and I'm very, very grateful for that.
Yeah, so am I. Yeah, we can't take it for granted, and we have to keep working at it. So that's why you're listening to the series. What is one piece of advice that you would give yourself if you're approaching perimenopause? Like, we have people from ages 35 up. So some people are just like, I'm not in perimenopause, why am I listening to this? Like, but we need to know something as we approach it. We need to know it while we're in it, and we need to know something as we get beyond it. What is one piece of advice that you would give yourself, or that you would give your friends? I'm
not allowed to, am I? I would say learn. I'm all about learning about the body, but I think the more you know about it, the more prepared you are. And that is certainly, I feel really empowered now. I mean, say I'm just heading into it. I've just started to notice some changes in my body, but I don't feel afraid. I'm like, okay, I know what might happen. I know things that I can do. I feel quite positive about it. And I think that really comes from information and being, researching and reading and speaking to people and finding out as much as I possibly can. So I would say, if you can do that, then you have a different attitude towards it, and you should feel much more empowered and able to look at it in a different light, because it doesn't have to be a depressing, awful time. It can be quite liberating.
Yeah I do believe it can be, and knowledge is what we will all stand on, right? Like, we can take it onto ourselves and take it for ourselves. So where can people find you if they want to know more?
Yeah, anywhere really. So my blog, drjulietmcgrattan.com, that's probably the best place. And on there's all the links to my socials. Obviously I'm on Twitter and Instagram and Facebook, but my blog's the best place to head to, and that's got the information about the books and things as well. So
yeah, and it's continual, and you keep on giving us a lot more information, so I thank you for that. Well, thank you so much for joining us and sharing your knowledge and writing both of your books, and all the best to you, and take care and keep up that strength training.
Yeah, thank you very much. Thank you. Yeah, definitely. I will be doing that because I found my why.
Yeah, I found your why. Take care. Bye-bye.
Bye.